So I'm a vet based in Broome. I've just moved up there in January from the middle of nowhere, Queensland, a place called Mooney. So yeah, I'm enjoying Broome and I've brought my lab with me, so I spend most of my day staring down a microscope looking at semen from just about everything. And actually last week I was trying to get some turtle semen to look at, so yeah, that's about as exciting as my life gets at the moment. But yes, I'm here today. I'm also on the executive of the Australian Cattle Vets, and I'm here to talk to you today about BioCheck and Welfare Check. They're two software programs which are really useful for producers to assess your biosecurity and your welfare on your properties. So, to introduce the whole idea of how Welfare Check came about, animal health and welfare are basically key contributors to your production. Important to the general public, important to farmers, and as Sally pointed out, very newsworthy items. Hence, the ABA recognised a few years ago now that we needed to put something together about animal welfare and production animals. And in 2017, as soon as the LPA made it compulsory for producers to incorporate welfare and biosecurity into the LPA program and have biosecurity plans, ACV jumped on board and put out this software for BioCheck first, and then Welfare Check has subsequently followed this year. So yeah, the LPA requirements now say that all farms must have a copy of the standards and guidelines that Sally talked about, and every PIC must complete online training. Staff must be familiar with your welfare standards and guidelines and start documenting and that these things are auditable. So yeah, the standards and guidelines are on the web. They're downloadable from the AHA website.
I've got some as well today.
Great. And yeah, basically they cover the nine main principles are your responsibilities, your feed and water, risk management for extreme weather events, natural disasters, injury, facilities and equipment, handling and management, castration, dehorning and spading, breed management, and the last two are really dairy specific, which are calf rearing and yeah, dairy specific. So today I'm just going to go over a basic welfare check that we actually did for my property back in Queensland. A lot of these aspects will not be as relevant on larger extensive scales, but they give you an idea of what the welfare check plan entails. So the main difference between the standards and the guidelines is that the standards are compulsory. So they include the word must. Everybody must do what the standards are. These are enforced by law in some states, and eventually in all states they will be enforceable by law. But also you must do it to fit in with the LPA program and to be able to sell cattle and sign off on your NVDs. The guidelines are what we should be doing. This is just a brief outline of where the standards and guidelines are at according to each state. They're in some states, they're in the process in other states, but eventually they're going to be national. They're just adapted under different parts of the law in different states, and it's a bit beyond me, but basically it's all compulsory under LPA anyway. So yeah, these are the 7 requirements of the LPA, and yeah, biosecurity and animal welfare are now the 2 bottom points there, but are the 2 major points for the LPA. So this is auditable by LPA, so they can take away producers' licence to sell cattle. So they must do an accreditation assessment now. That's online trainings available to all farmers, and they must be now documented. So this is where the welfare plan fits in. So this is where an ACV vet can sit down with the producers and help you document this plan, and you're all in place. So the role of the vet in these plans is as your advisor. We're not acting as the police, we're not the auditor. We just help you plan, recognise where your shortfalls are, where your strengths are, and look at some aspects where you might feel there's room for improvement, and to talk to you about what other people are doing and what's available. So we sign off at the end of it. We sign off on a discussion. We're not saying that you do these things, but there's a discussion, you've thought about it, this is part of your plan, and you keep the bookwork. It's also reviewable every year, so we can say, okay, yeah, we have made those changes, or yeah, no, we haven't. We've changed our mind and we've decided that no, that wasn't economically feasible. We're going this way instead, or whatever the changes may be. So how we record it is we identify these risks. All of these guidelines comes with practices, and these practices are then checked off with a tick if the risk is controlled. You've got to cross if they're not controlled, and they've got to have something done about it straight away, because this is a standard that we're not up to. Or it's an exclamation mark where the risk is partially controlled, but we're going to think about it and do something else over the next 12 months to improve it. Some of them are not relevant because they're only for dairy or intensive farming situations. So this is just screenshots of going through this software program with the producers, and at the top we have everything. Can we see it? It's a bit faint. But in bold there is where we're up to. That's a guideline. It's under number 1 of the standards and implementation, and that is that a copy of the standards, it has to be available to all staff members on induction and in the office. So yeah, still on one of your number 1 point responsibilities, staff training's another one under there. We have about 9 subheadings under each of these, under the main headings, under each standard. And this is just, all staff on induction are, supplied with a copy of the standards, and they are advised on animal welfare. This transport section has been added mainly for the Kimberleys and Pilbara, because we're the ones most affected by long transport. And in the bottom area, down the bottom, is where you can make your comments about how you're fitting this into your own farm. So yeah, for our own farm, we look at preg testing your females, everything over 300 kilos, to make sure they're under 6 months pregnant before they go. And also that a copy of the fit to load guidelines is available and in all the yards. The second section is feed and water. So the feed and water section just looks at basically that all animals have the right amount of feed to maintain their body condition score and appropriate body condition score. And by this is where you're categorising your animals into different nutritional requirements comes into your comments, and what your feeding ratio is and your rotations. Feed and water also looks at problems that you might be prone to. So acidosis is one of those if you're feeding grain. For us, we probably have a lot of prussic acid issues with sorghum. There's a lot of forage sorghum, feeding sorghum hay, and doing these sort of testing. So ruling out diseases associated with feed. Water quality. This is actually a bit of an interesting one. Water quality is important. They must have access, obviously, to clean and fresh water at all times. And this is actually of economical benefit. There's been some studies out to show recently that cattle on clean water compared to dirty trough water were actually gaining 100 grams of weight more per week than those on dirty, unclean troughs. The people writing the article theorised that it was probably about bacteria, having the right bacteria in the rumen. But I think there's also probably room for it to be related to urea, and whether you could increase urea levels, which are actually decreasing your weight gain. And there's also been a bit of study that hasn't been published yet showing that these increased urea levels in unclean troughs will also decrease your conception rate. So there are also economic gains from having clean and fresh water available. Yeah, okay, the third section is your risk management event. And so here we look at extreme weather, if you've got a fire plan in place, if there's a drought plan for your farm, and what your plans are if you have a machinery breakdown, or if there is a fire or flood. Yeah, so I mean, some of these fire plans can be really detailed for properties, or otherwise, they're pretty simple. So, for our place, we've got cultivation, so obviously we need to move cattle to a vacant cultivation paddock if possible and away from the fire. And you're just looking at, having your gates open where your water is, and basically keeping your fire breaks around your feed clean at at 5 times. Drought plan. Every farm's got a drought plan in place, or should have a drought plan in place, when they're going to sell their cattle, when they're going to offload, what feed reserves they have, how much they have in storage. And these can just form an appendix to part of this welfare check plan, or can be written in detail in the plan. So the 4th section looks at your facilities and equipment, and some of this goes into depth on dairy farms, but a lot of it's just about your yards, that you haven't got protrusions in the yards, that the yards are designed with shade, water, in mind, dust, if dust's a problem. And here on this plan we're saying, yeah, okay, we haven't got much shade apart from over our working areas, that we've got to grow a few more trees to, help with the weaners in the yards. So yeah, insect worries are another one under this section, and ours are putting some back rubs out where at water points when there's a high fly presence. Then we go on to point number 6, which is probably a bit more topical, which is castration, dehorning. And so here we're looking at what we're doing, how we're going to use some pain relief. Often the best way to introduce using pain relief is to only do for half your calves at branding, and then separate them and see if you can see differences. And most people report large differences in seeing when the calves go back to suckle, and their posture, and there's been studies showing their weight gain up to 10 weeks afterwards is improved when they've had some systemic pain relief prior to castration. I had to put this one in. Breeding management, obviously testing your bulls is very, very important, and including your morphology. By testing your bulls, you can pick up any genetic defects which might be passing on some animal welfare issues, not just to that bull, but such things as bad feet and lameness issues which are going to flow through to all your stock. And so this is an example of the welfare check plan when it comes out. This is actually printed out here, so I might just pass that around and you guys can just have a bit of a flick through it. And that is the plan for our place, and at the back is a biocheck plan, if you wanted to flick it around. And I'm now just for some photos because that's all a bit dry. So bull testing for animal welfare issues. Here's a couple of photos of some hereditary feet defects, these sort of things to pick up on bull testing. Obviously anything with overgrown feet is going to become lame and break down, but also it's going to pass on overgrown feet to the females. You're going to have shorter longevity in your herd. Fibromas, that's a big problem in some breeds, and they're hereditary as well, so you're checking for them when you're bull testing. This fella here is pretty classic post leg. You can't see him very clearly, but that post leg is going to result in DJ joint disease of the hocks, and he's going to become lame before he puts on too much more weight, and obviously that's going to be passed on to the females as well. And it's a hereditary defect that we'd be culling that bull out at bull testing. Again, a low pizzle, a prepuce on the wrong angle, it's going to result in some pretty nasty situations for that bull. But we can select away from that in the bulls by drawing a line between the hock and the knee and make sure that the pizzle's sitting up above that it's not hanging down at 90 degrees, so we haven't got a big umbilicus in the front. So bull testing is important for animal welfare. And that's just, you can't see it very well, but another one where it's dragging along the ground. These ones are probably a bit more subtle. We've got one here that this bull's got 2 penises. That doesn't mean he can do 2 cows at once, it just means it'll be very painful for him. And there's another hereditary penile defect, which is a stenosis here, that's retained frenulum, which is stopping the penis from coming out or tearing it. Again, another painful hereditary defect. can't see, sorry, as well. But yeah, the scrotum here is enlarged in a couple of bulls, so bigger is not always better. And this bull here has had a urolith stuck from getting a bit too much grain feed, and yeah, it's caused an obstruction to his urethra, and his whole penis is blown up. And when we're bull testing, we're looking for animal disease as well. We've got some IBR lesions on one of these penises on this side, and then you've got your papilloma virus on the other penis on the other side. Obviously, very painful conditions. Okay, now no more photos of bulls' penises, but onto biosecurity plan. So yeah, biocheck plan is the same format as a welfare check plan. It comes from the same software. So all ACV vets, all accredited Australian cattle vets have access to these plans, and they have the skills to go through these plans with you and sit down with the software and go through stage by stage. So the biosecurity plan is based on the AHA generic plan. And once again, it's not a quality assurance, it's just that you've had the discussion and the vets sat there and walked you through it. I'm not going to go as in depth on the biosecurity plan. There is one printed out, an example in that book that's circulating, but basically, once again, we've got 9 sections. You've got your farm inputs, where stuff's coming onto the farm outputs, people, vehicles and equipment, productions and practices, ferals, and your paperwork. So your farm inputs to consider for biosecurity are new plants and animals coming in, animal feed, banned animal material, your water sources, animal bedding and fertiliser. Your farm outputs are obviously animals moving off the property or back on the property if they're for sale or lease or for show. People, this is, as Graham pointed out, people can transmit a lot of these diseases as well, so limiting your visitor, assessing your visitor risk, signage, looking at how many property accesses you have, and just general hygiene. Vehicles and equipment, that's big ways of transmitting weeds and diseases, having dedicated clean down areas, watching your runoff from your vehicle washes, looking at your vehicle movements around your property, trying to minimise them, and looking at your access roads and your access tracks. The biocheck also goes into a lot of your production practices, and you're looking at your water management, your animal manure and waste, feed management, fencing. We look at the diseases that you can vaccinate against, and your zoonotic diseases like Q fever and lepto that Graham was talking about this morning. Wild and feral animals obviously have to be considered as part of a biosecurity plan, and assessing your risks, weeds, and your general cleanliness of your property. And once again, the whole point is to train, plan and record. So the biocheck is part of the LPA requirements now, that you need to have this, and it is auditable. So the biocheck plan satisfies the LPA requirements for your biosecurity needs and for your welfare needs. So both these plans are available through your local ACB vet. Bryce knows all about it, and so does Cozzy up in Broome. But, so, any questions? No. Well, I'll pass over to Bryce then.
Rightio. Okay, so everyone's all seated, all good? Okay, I'd just like to welcome everyone. The initiative of the KPCA to hold an Animal Welfare and Management Day, I think, is a really good initiative that needs to be done more. I think as an industry as a whole, we need to start voicing and putting forward the good things that are happening. It's often that we sit mute and the media takes control and puts in what they think, and we just sit there mute. And unfortunately, if you remain silent, you're guilty. So we've got to start having more days like this, and all be sort of proud of the industry we're in, but understand the animal welfare side of it, and start pushing that and saying, well, no, this is actually what we do. And it's going to be really important for the longevity of our industry. I just want to reflect quickly on what Graham spoke about, and Tracy as well. So Graham spoke about understanding biosecurity and diseases coming into your farm, and Tracy enlightened on that in her bio check. Now this is really important, and it can cost you a lot of money. So for example, I just want to give a quick example of it, because people often, they'll bring new bulls in or a new line of female cattle, and they'll put them straight out in a paddock with existing cattle on their farm, with not knowing any disease status of those animals. It's the best way to cause yourself a heck of a lot of heartache, and I've seen that this year on a couple of Queensland properties. They bought new bulls, they didn't know the disease history, they didn't investigate those bulls or quarantine them when they came onto farm, put them out with their heifers weren't vaccinated against vibriosis, so they were naive to Vibrio. Those bulls were active carriers of it, and their their conception rates were down by 40%. So biosecurity and understanding diseases or potential diseases that could come in with cattle you're bringing in is really important, and it can cost you financially quite considerably and take several years to get that back. So I just wanted to reiterate on that, because those talks were really good. Now I'm talking briefly about pain management. I was responsible for getting, or Troy to sponsor the day, so I sort of have to give them a bit of a plug, but I'm talking about 3 products that are relevant to you, and that some of you use one or maybe even both of them at the moment. So I'm not trying to push their product, but I do want to acknowledge that Troy has sponsored the day as part of the day, and do that formally. So, and for you, those of you that don't know me, I'm a managing director and co-owner of a veterinary business called Broome Cattle Vets. We service the export industry both in the north and also down out of Perth, and we also do all the station work in Western Kimberleys as well. So what is pain? I just want to give a definition from the International Association for the Study of Pain. They define pain. Pain is an unpleasant sensation associated with actual or potential tissue damage and resulting in physiological and behavioural changes that indicate a stress response. So that's, and I know that every one of you here have seen animals show behavioural changes or voice that they're in pain or stressed out. Now, there's 2 types of pain. You've got your physiological pain and your pathological pain. So your physiological pain is basically a sensation, say if a cow's walking along, steps on a stone, they move their foot quickly because they're trying to avoid hurting themselves further. And this is a pain that could be instant and sudden, but once they've removed their body from that pain, it will stop. Now you've got your pathological pain, and we're all aware of this, or you see that through actions that we do and management tools that we do need. So this is tissue damage. It's caused by dehorning, branding and castration. Now that tissue damage can cause inflammation and then ongoing pain messages that keep feeding back to the brain and saying that there's something going on and my body's hurting. Now if you do several procedures at once, that can amplify the message going back to the brain, so that there is that pain relief. I'm just going to wait for this truck to go past. So you can amplify the pain the animal's feeling by doing several procedures at once. Okay, possible pain scenarios for your enterprises. You've got ear tagging, ear notching, disbudding and dehorning, castration, transportation and branding. Now all these things can lead to inflammation. They can also lead to infection, and then obviously discharges as well, and secondary infections. Now, why should you manage livestock pain? I think it's pretty obvious. One, we should be, and we should be actively trying to improve it. There's no answer to just stopping pain, because these procedures we do put animals in stressful situations and they are uncomfortable and they do cause pain, but there are products out there that combined will help minimise or reduce that, and we can finally be seen as an industry to be doing things actively to try and minimise it. So your pain, the main things from this, your pain changes behaviour. Animals are stressed, they're not going to want to drink, they're not going to want to eat. So then you see weight loss. It also, basically, because you're increasing adrenaline and increasing your cortisol levels, those wounds that you've created, say from castration, take longer to heal. Now, again, the consumer wants us to show that we're providing the best care to the animals that we're selling them. And in a service industry like mine, the consumer is always right, the client is always right. So we're trying to sell a product. If they want something, we've got to meet them and do it. Welfare standards require it, and you've seen that through your welfare check that Tracy just went through, and your business needs it. So sometimes there's confusion between anaesthetic and analgesic pain relief. So I just want to quickly go over it, and there's two types of anaesthetics, but the one that you're most familiar with will be a local type of anaesthetic. Now that anaesthetic occurs quite quickly. It temporarily blocks all the sensation, including pain. Now an example of this is trisulfan, that a lot of you are now using. An example, say in the human world, is say if you go to the dentist and he gives you a lignocaine injection before he pulls your tooth out. And then you've got analgesic. So that temporarily eliminates pain, but it does not decrease all the sensation. And two types of that we're using in the industry are buckalgesic and Medicam, which are both basically using the same drug constituent, which is a non-steroidal anti-inflammatory. So it's like if you've got a headache coming on and you take Nurofen. So I just want to go through trisulfan first. Trisulfan contains two types of local anaesthetic. You've got the fast-acting lignocaine, which provides immediate pain relief, but it still does take 5 to 10 minutes to kick in. It's not immediate. And you have long-acting bupivacaine, which lasts longer than the lignocaine. And you also have adrenaline, which is meant to help reduce blood loss, and also cetrimide, which is just like a local disinfectant. So trisulfan is a gel. You spray it on the wound. I'm seeing a lot of people using it now for dehorning and for castration. Now it's not preventing that initial pain that you're causing from doing the procedure, but it is helping with the pain felt following that procedure. It's easy to apply. People say that because it's covering the wound, that it's helping with keeping out bad infections like dirts and things, so keeping that wound clean, and by keeping that moisture in, helping the wound heal quicker. And it's labelled to have a 24-hour period of activity, up to. Now the other one, and we use this quite a lot on the boats for cattle with lameness, and we use it in the feedlots a lot as well for cattle with swollen legs, wounds and lameness, is Medicam. So Medicam is concentrated at 5 milligrams per mil, and it's a non-steroidal anti-inflammatory. It gives anti-inflammatory relief. It's an anti-inflammatory, an endotoxic, anti-exudative, an analgesic, and an antipyretic, so it brings down your temperature. But basically, to sum it up, it is given to provide or decrease the intensity of inflammation and the subsequent pain associated with that inflammation. So it's injected subcutaneously under the skin, or you can give it intravenously. Provides, and this is why I like it, it provides pain relief for up to 72 hours. So you're only giving that animal one injection and bring it into the crush once every 3 days. And generally after that time, if that animal's not starting to decrease in pain, particularly if it's a lameness, you should be using conjunctive therapies like antibiotics to try and stop that problem. It visibly reduces pain-related behaviours, and also when I've got animals that have got a temperature associated with an infection that's causing pain, once I've given this injection and I record that animal's temperature again, I can see that it has worked because the temperature does come down. The other one, and this is the Troy product, but buckalgesic. Now this is a product that I was sent some trial packs, and I basically didn't push it upon the producer, but I took it out, left it with the producer, said, can you do 100 out of 200 of your weaners or your calves, tag them, let them go, tell me what you see. Like, do you see anything? Are you interested in me getting more in? Now, to date, we have 30% of our clients in the Kimberleys and Pilbara on are purchasing buckalgesic through us, and annually now they ring up before the start of their season and order the amount that they think they're going to require for the season. So that product's basically sold itself. And buckalgesic is a stronger concentration of the meloxicam that I just spoke about in the injectable form, but it comes in a gel form. So it has all the same anti-inflammatory factors and analgesia as the injectable form, but you give it between the back teeth and the gum, and it's a drench. Well, not a drench, it's a gel that you're basically putting between the cheek and your back teeth. Now, ideally by label, they say you need to give this because it takes 10 to 15 minutes to act, and that's not, I know it's not practical in this situation, it's recommended, but even giving it at the time of the procedure, although they're not getting that immediate pain relief, they are getting it when they walk out of the crush. And when clients send me videos, and when I've been there when they've done the procedures, you can actively see through behaviour that those animals are less painful, and you can see that if they're going back into, if their calves going back in with their mothers, they are much quicker to go and start drinking milk again. That's a pretty good indication that they're feeling more comfortable. So it's an oral administration. Again, it provides up to 72 hours pain relief. It's got a really wide safety margin, so if you overdose an animal and give it 30 ml instead of 5, it's still going to be okay. It's not as, because it's a COX-2 inhibitor, which is some fancy scientific thing that I can't explain, but it reduces the impact that has on the gut and the gut flora as well. So it's quite a safe product to use, but you wouldn't use it week on end. It's 1 to 2 treatments and that's it. And with the buccal-gesic, it's got a meat withhold of 14 days and an export withhold of 21 days. So basically, in conclusion, happy to have a bit of a discussion if you want to talk about it, is that visual behavioural changes are seen post-medication with these products. I believe using a local, say, trisulfan and buccal-gesic in combination is a better way of approaching it. So they work best together. And basically, as an industry, you guys have to be seen, although this doesn't reduce all the pain, and some people think it's a pain and an extra cost, you have to start addressing pain relief in the industry, and we have to actively be seen to do that. Now, there's been studies done on all these products to try and say if there's any financial gain from using them. Initially, there can be increased weight gains in the animals that have been treated with pain relief, but after a month or 30 to 60 days, they plateau out, and by the time they're weaning age, the weights are very much the same. So you can't really look at it as it's going to enhance the profit or the bottom line. We need to be doing this to start to show people outside the industry, show consumers that we do care about our animal welfare, and we're using the products that are available to us now that we feel work the best. So that's my brief and short talk, but thank you all for coming along, and I hope you have a good weekend. Very good. Thanks, Viv. Oh.
Thank you, Bryce. Is anyone using it? Does anyone want to, give some opinions or anything?
Problem we got all of the Kimberley guys. Got 5. No one's here from the Kimberley.
I can back you with the back of Jay-Z. We use that in Kilchina. You could definitely tell the difference between the cattle that had been treated with it and the cattle that hadn't been treated with it.
Yeah.
We're using it down at Sherlock, and we just noticed it's getting the cattle off the fence sides a lot more once they're all processed and get them out. Like it's going to start grazing instead of just doing that walk around them to see their mothers or whatever. He says, yeah, that's what I've noticed.
Well, we've had clients, so we've had about clients that mark and wean about cumulative 30,000 head a year, and they're using it it's not one client, it's several clients, they're using it annually now. So, and over with the eastern states in the dairy industry, it's actually becoming quite compulsory to be using it. So it'd be good to finally get ahead of the dairy industry and say, oh yeah, we don't have to make it compulsory, most of our producers are using it. Anyway, food for thought. Thank you for listening, guys.